So, you're a radiology resident. You've definitely heard of the big exams, right? The FRCR, the USMLE, they're kind of the household names in medical certification. But you know, there's another major player on the international stage that you really need to know about.
And that's the EDiR, the European Diploma in Radiology. You're probably seeing this pop up more and more, and for good reason. But let's be honest, it also comes with a whole lot of questions.
You're probably wondering, is it a real alternative to something like the FRCR? What's the actual value of having this on your resume? And the biggest question of all, is it the right move for your career? Well, today we're going to unpack all of that.
Okay, so let's just dive right in. First things first, what in the world is the EDiR exactly? Let's get a super clear foundational understanding of what we're talking about here.
EDiR, as you can see, stands for the European Diploma in Radiology. It's an exam run by the European Board of Radiology, or EBR. Now, if you're going to remember two things from this slide, it's these: internationally recognized, and its whole purpose is to test your clinical radiology competence.
So what's it built on? Well, it's all based on the European Society of Radiology's training curriculum, which gives it a really solid, respected foundation. Its main goal isn't just about whether you can memorize a textbook. It's designed to test your practical, clinical skills. And that's what makes it a credential that actually carries weight across the globe.
And this is probably its biggest selling point. Unlike other certifications that are broken up into multiple parts that you take over several years, EDiR is just a single, comprehensive exam. It's one test, one shot to validate your skills. And believe me, that streamlined approach is a huge deal.
Okay, so we know what it is. The next logical question is, who is this exam actually for? Is it something that fits your profile, your ambitions? Is this something you should be thinking about?
EDiR is a fantastic fit for a few specific groups. If you're a radiology resident or maybe an early career radiologist who wants to benchmark your skills, it's a great option. It's also, obviously a strong choice if you're thinking about working in Europe. But here's the kicker. It's perfect for anyone who wants that international credential but doesn't want to commit to a long, multi-step exam process like the FRCR.
All right, let's get into the nitty-gritty. What does this exam actually look and feel like when you're in the hot seat? Because understanding the format is absolutely key to figuring out how to prepare.
The whole thing is broken down into three main sections. First up, you've got your multiple choice questions, or MCQs. These are a mix of image-based scenarios and some theory. Then you have the short cases, which are all about fast-paced image interpretation and spitting out a diagnosis. And finally, you have the core component, which, well, it's really the heart and soul of the EDiR.
Let's spend a second on that core component, because this is not your typical exam section. It's designed to simulate what you actually do day in and day out in the reading room. You get a case, you analyze it step by step, you have to decide on the next best investigation, and then you interpret the findings as the case unfolds. It's a genuine test of your practical, decision-making skills.
Now, the exam covers the whole spectrum of radiology, everything from neuro and MSK to peds and emergency cases. But the really crucial thing to understand here is that it tests these subjects in an integrated way. It's not siloed. It's not like, okay, now for the neuro section. This whole approach mirrors real life, right? Because patients don't show up with problems that fit into neat little subject boxes.
All right, you know what the exam is, you know what it looks like. Now for arguably the most important part, how in the world do you prepare to pass it? This is all about having a smart strategy, not just brute force studying.
So here's a simple but super effective four-step plan. First, you got to build your core concepts, but focus on the common, high-yield stuff. Don't get lost in the weeds with super rare conditions. Second, and listen, this is the big one, practice cases, over and over. Case-based learning is the absolute key. Third, make it a daily habit to review images and do some MCQs. And finally, always think clinically. For every single case, ask yourself, okay, what's next? What's the next logical step?
This slide really gets to the heart of the right mindset. On one hand, you have the smart prep, clinical thinking, tons of case practice, always understanding the context. And then, on the other hand, here's where people go wrong. They treat it like a theory exam, just trying to memorize facts, ignoring context, and not practicing nearly enough cases. That's the recipe for failure here.
And that brings us to the big showdown, EDiR versus FRCR. For a lot of you, this is the ultimate decision. So let's put them head-to-head and help you figure out which path really is the right one for you.
So when you break it down, it's all about trade-offs. EDI is a single exam, a shorter process focused on clinical reasoning. The FRCR, That's a whole different beast. It's a 3-step marathon. It's way more detailed, more structured, and yeah, it's generally seen as having a higher difficulty ceiling. It's a long-term commitment. So, practical application versus deep, structured knowledge.
So, the verdict? Is the EDiR actually worth it? The answer is a huge yes, if it aligns with your goals. If you want that respected international credential, if you love clinically oriented, case-based challenges, and if you're looking for a more efficient pathway than the multi-year FRCR, then EDiR is an absolutely excellent choice.
But I want to leave you with a really important way to think about this. EDiR is not a shortcut. It's not a replacement for rigorous, deep residency training. The best way to see it is as a final seal of approval, a formal, internationally recognized validation of the clinical competence that you've already worked so hard to build.
So there you have it, the full picture of the EDiR, what it is, who it's for, and how it stacks up. You know what it takes to succeed. So the final question really is for you. Is validating your clinical competence with this diploma your next big step?